Hey guys, Voracious Prepper here. Today I'd like to do a very short video on a basic trauma kit that I put together. This one is specifically geared towards stopping bleeding, nothing more, nothing less. In the near future here, I do plan to do some good first aid content, showing you how to piece together quality first aid kits. Depending on the situation, like I plan to do like a different tier system, 1 through 3, 3 being the most sophisticated first aid kit. This one is going to reside in our car. I do want to make another one of these at home because I do have a very sophisticated first aid kit at home, but I don't have something like readily accessible and available like this is, which is specifically designed to stop bleeding. As I said, this is a very basic kit. It's nothing overly fancy, but it's something to get you guys going and give you a general idea. With that being said, guys, let's hop into the video here. Unfortunately, my tourniquet pouch, the button sheared completely off, so I gotta get a new one of these guys. But within it, what's housed inside is a cat tourniquet. These are very popular tourniquets. They've been around for years. There is all sorts of quality tourniquets out there now. There's like the everyday carry tourniquet, which is the same exact design as a cat tourniquet, but it's shrunken down. There's something called a rat tourniquet. So there's good tourniquets out here, but this is just what I have. Very brief description of how these work is they're specifically designed for limbs, so your arms or your legs. If you're having arterial bleeding on your arms or your legs, the way that this would work is you would apply it a few inches above where the site of the bleeding is, and you would wrap it around and you would cinch it down very tight with the Velcro strap, and then you would use this windlass arm and turn it counterclockwise or clockwise very, very tight until the source of the bleeding stops, okay? And then it locks into here in this little recessed area so it doesn't unwind. It's important that you write down the time that you applied the tourniquet because depending on, it's imperative for the medical personnel to know because different procedures are going to be at call depending on how long the tourniquet has been applied. So it's very important that they know. Now if you're on a 911 call, it's probably safe to say that everything is recorded. It's not even safe to say, it's just a guarantee. But still, if you can remember, try to write it down. I need to include a Sharpie here or something. I do not have that on hand. Behind it here I have some ammonia towelettes. You may have seen like weightlifters and like football type dudes sniff something called smelling salts. Essentially it is a very strong odor of ammonia, and it is the best description, I've tried it once or twice, it's very, very sharp and pungent when you smell it. So if somebody is unconscious due to passing out, it may hopefully bring them back to consciousness because, as I stated, it really sparks your ass awake. I think if someone is on the verge of losing consciousness due to like extreme blood loss, if you can try to bring them back, I think you should try with something like this. Obviously, if it gets to the point they need CPR, that's a totally different story. But sometimes people even pass out from the sight of blood. Their vasovagal nerve will just go haywire and their blood pressure will bottom out. And they'll have a short episode of syncope, of passing out. So that's basically why I have it. I have 2 of them here. I have a very crusty pair of shears, and I do plan to invest in a better pair here eventually. The reason that shears are important is because if somebody is severely injured, the worst thing that you could do is try to manipulate their legs and their arms to try to take their pants off or to take their shirt off. Like stating if there is bleeding under there, you need to access it immediately. You don't want to be moving their limbs all over the place because you could cause way more damage and cause them unnecessary amounts of pain. So ideally you want to cut away and expose the area where the bleeding or the injury is rather than like trying to manipulate their limbs. You know, you want to try to minimize damage. So that's why shears are kind of important. I'll probably get some like Leatherman Raptors, but they're kind of pricey. I have a basic flashlight here to see in the dark if it's nighttime out. This pouch I've had for a long time. It's called a Condor EMT Ripaway pouch. Different ways you could design it, but it's got this huge Velcro on the back. So if you have it attached to something, maybe like a chest rig or something like that. It's designed to easily rip away. But yeah, I'm sure they still make these. Like I said, I've had this one forever. Unfortunately, my critters got it all hairy, but yeah, they're pretty affordable. 511 makes some good ones, and so on and so forth. Anyways, we'll hop on in. And like I said, very basic kit. Here I have an emergency compression bandage. You can almost think of this similarly to like a tourniquet. It's a combat bandage. If there is a heavy bleeding area on a limb, you may even be able to use this on the abdomen depending on how big the wound is. But it's designed to cinch down very, very tightly as well. And it's basically a very thick pad of gauze, very absorbent. So it's designed to help stop bleeding. So I have one of these. I would like to get a couple more of these. As funny as it may be, I have some feminine pads in here. I want to get some super absorbent ones, but gauze pads are really expensive, guys. Like, they're not cheap, and I'm sure these are not cheap either, feminine pads, but I feel like they're probably a little bit more affordable than like medical grade gauze pads. So I want to get some really big, like super absorbent ones, and it gets the job done. That's all that matters, applying pressure, 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 pressure. And you're probably going to go through a lot of gauze pads, so I have an enormous amount of gauze pads, and I even got some tucked away back here. So plenty of gauze pads. And then I have some nitrile gloves. I have a couple pairs because you want to keep yourself safe from bloodborne diseases, and also if you can minimize getting the other person potentially with some form of an infection, you know, you got to have gloves. So I have a couple pairs because maybe I could use an extra hand or something, you know, or maybe a pair rips, you never know. So I have a couple pairs of those in here. And like I said, just an abundance of gauze pads. I also got some gauze rolls, a couple of these. So after you apply, you know, a bunch of gauze pads, you can wrap very tightly. Basically, it's like the compression bandage. Use a bunch of gauze pads and then wrap with one of these or something like that. I need to include an ace wrap in here. I just got to locate them. I have a couple around here somewhere. And we're almost done with the kit, guys. There's a few more things I'd like to add in here, like Quick Clot. I'd like to get a bag or two of that. I don't have any of that, but it's essentially a powder that's designed to coagulate blood and stop bleeding pretty rapidly. I have an emergency Mylar space blanket. If someone is experiencing a lot of blood loss, they can get cold. If they're going into hypovolemic shock, there is a good chance they could be hypothermic. So, you know, if it's sunny out and you apply this, it will help retain body heat and warm them up. So I have one of these. And then I have this hyphen vent chest seal. What this is designed is for a sucking chest wound, which is medically called a pneumothorax, which is basically a collapsed lung. So if somebody gets stabbed in the lungs or shot in the lungs, they have a high probability of their lung collapsing because the bleeding is going to accumulate between the lung and the chest cavity, and it's going to compress the lung. It's kind of hard to explain, but these are very well known and notoriously used in the medical community. They work very well. They are vented, which is more ideal. You want them to be vented. I want to get a couple more of these. As you can see, entry and exit wounds. So if somebody is shot, for instance, or has something pierced within their chest cavity, it's important that you check on the other side and make sure that there isn't a clean entry and exit wound, because if there is, you need to apply one on the front and on the back. And there is some more things that pertain to this. I am not registered EMT or anything, so I don't want to give you like false information. I think it's imperative that you check it out yourself. But sometimes you need to vent these manually and clear it out if too much blood coagulates and stuff. It's essentially called burping. I will let you guys check that out, though. I don't want to give out too much information because I don't want to be liable. But yeah, I do have one of these, and I do want to get at least 2 more of these and have like at least 2 of these or 3 of these in each trauma kit. But yeah, it's a vented chest seal. Here on the back you can see how it works. Here's the vents here, which will essentially allow when the person breathes in, it essentially allows the person to breathe in and it seals off, but then when they exhale, the blood vents out these vents here. There's more to it, some science to it, but yeah, this is basically it, guys. It's a very simplistic kit, and like I said, specifically geared towards stopping bleeding. There is a lot of vehicle accidents out there, and I feel like a very common thing is going to be bleeding. So whatever you have to stop bleeding, you know, a shit ton of gauze pads, some feminine pads, whatever you have, you know, just I want to get some abdominal pads. They're a lot thicker, but like I said, these guys right here, man, they're cheaper too, and they get the job done, and that's all that matters. But I do plan to do some more videos like this. But yeah, when there is bleeding, the most important thing is to stop the bleeding, and that means a lot of these and a lot of pressure and holding it there and doing your best and waiting for emergency personnel to arrive and do a far more sophisticated job. But if you're on site first and you can stop the bleeding, just do it. You should. This pretty much concludes the video, guys. I hope you enjoy, and I hope you guys enjoy your evening. Take care.